I'm moving forward every day, Jesus. I just let him lead the way every second, every minute, every hour of the day. I'm moving with Jesus every day. 24/7 with Jesus every day. 24/7. I'm moving with Jesus. I'm moving with Jesus every day.
In Matthew chapter 6, verses 22 and 23, Jesus says these words, "The eye is the lamp of the body, or the light of the body. If your eye is healthy, then your whole body shall be full of light. But if your eye is unhealthy, your body shall be full of darkness." Some people have eyes, but they cannot see. And some people can see, but they have no vision. So the eyes are important, so says Jesus. And today, our subject is the eyes have it. And I've enlisted the services of two qualified and able-bodied optometrists in the person of Abigail Cezair and Sheressa Gangadeen. Thank you for taking the time, and thank you for finally making it to JC 24/7. So Abigail, I will start with you. Who or what is an optometrist?
So, optometrists are the primary eye care providers of the eye and the visual system. We are trained to check your eyes for glasses as well as fit contact lenses. We look at the health of your eyes as well as detect diseases.
Okay.
Yes.
Okay.
Many optometrists, they practice a wide range of optometry, but a few people, they would specialize in specific things. So one specific field is low vision rehabilitation.
Right.
And this is for persons who are low vision or they have very little vision. We're able to assist them with seeing as much as they can with the help of telescopes, seeing in the distance.
Right.
And if they are reading, with the use of magnifiers.
Okay.
Another aspect that they may specialize in is in sports vision. So they would check athletes to make sure that they have good eye and hand coordination,
Okay.
as well as their eyes are able to track properly.
Okay.
Another one is pediatrics. Yes,
Interesting.
so checking the vision of children. And another one is binocular vision therapy.
Wow.
So persons who have cross eyes, or what we would call cookie eye, we're able to help with them to focus and for both eyes to work together.
Right.
Yes.
So if I were to come to you as an optometrist, well, you are the optometrist, and I have an eye challenge or some challenge in my eye, is it that you will operate on my eye and fix it and make it whole?
Oh, no.
Okay.
We don't do any surgeries, neither do we treat diseases.
Okay.
That's the field of the ophthalmologists.
Okay.
They are the medical doctors who would have specialized in the field of the eye as an organ.
Okay.
Yes.
So I take it that you guys make referrals to ophthalmologists.
Yes,
Is that
we do.
correct? Okay. What about the optician?
Oh.
Who's an optician?
They are the ones who would fit you for the glasses, take
Okay.
any measurements, and dispense the glasses.
Okay.
Yes.
Fortunately or unfortunately, I have a pair of spectacles, and I
really?
suppose that I've gotten it not from an optometrist per se, but from an optician.
Oh, okay.
Optician.
Yes.
After doing some eye exams.
With the optometrist.
All right. All right. Sherry, let's bring you into the discussion. I suppose that there are some things that we, when things happen to our eye, we feel like we can fix our eyes, we can, remedy certain things. What are some of the mistakes we make in caring the eye, and some of the myths that we have about eye treatment and eye care?
Right. So before I get into them, I just want to stress the importance of the eyes.
Sure.
They're the first things that we open in the morning
Right.
and the last things that we close at night.
Wow.
And during the course of the day, we use them thoroughly. So the eyes are very precious to us. Yet somehow we may fall into some habits that may not be beneficial towards the eyes. So I'm just here to talk about some little mistakes and myths.
Right.
So the first mistake I'll get into is rubbing and touching your eyes. Sometimes, just like any other part of our body, our eyes may become itchy. You may get that sensation to rub it. And if you must, you will make sure that your hands are clean. So you wash with water and soap. You close the eyes, and then you would gently massage the area to soothe that sensation. However, if the itch persists for more than 3 days or so and the eyes get red, the symptoms worsen, then those are reasons to come in for an eye examination. There could be more things happening there.
Okay.
Apart from just rubbing the eyes, you would want to pay attention to the risks that are involved.
Okay.
For example, you can scratch the eye, you can get bacteria into your eyes, can transfer from your fingertips to the eyes. And for persons with astigmatism and keratoconus, and astigmatism being a refractive error that interferes with your clarity of vision, your ability to focus clearly, whether for distance or near tasks.
Okay.
And keratoconus being that where the eyes are shaped more in a conical shape rather than in a spherical shape, the cornea of the eye.
Right. Okay.
So rubbing the eyes have been shown to worsen these conditions. So there is absolutely no good way or no reason for rubbing the eyes. You would want to desist from that, or as I said before, if the itch persists, you get an eye examination.
Okay.
The next mistake would be, apart from that, is going straight to the pharmacy instead of going to the optometrist or your ophthalmologist and getting an eye exam done.
Okay.
So when you go to the pharmacy, you would get something to treat the symptom, but you would not have ascertained the real cause. And to be able to ascertain the cause, it will be through your eye exam.
Right.
So the optometrist getting your examination done is a very vital part. Don't just skip and go to the pharmacist if you have a problem.
Okay.
And so next I will also talk about some eye twitching or eyelid tics or so on, and these basically are spasms in the eyelid muscles. It could be either your superior eyelid or inferior eyelid, and they are caused by a number of things: tiredness, straining the eyes, lack of sleep, too much alcohol or caffeine can also contribute to this eyelid twitching. So depending on the cause, it will tell you what you need to do to help that problem. Even allergies and dry eyes can contribute to eye twitching. So it's important, if you have these things, to get your eyes examined, right? Another mistake would be waiting until something is definitely wrong with the eyes before getting an eye exam. So for healthy persons, we usually advise that you see us biannually or every 2 years. And if you have diabetes or some form of chronic illness or something that we are monitoring, we can choose to see you anywhere from 3 to 6 months up to a year.
Right.
And for kids especially, we like to see kids yearly or every 6 months. It depends on their age, and it depends on if there's anything we're monitoring in their development. It is very important with children not to wait to see if, for example, if they're complaining about blurry vision, you see them bumping into things, they're holding their reading material very close, going up very close to the television, or if you notice an eye turn. It's not wise to wait to see if the problem will resolve on its own.
Right.
You go to your optometrist, get an examination, and get consultation from us, and we can see how we go on from there.
Very good.
All right. And my last mistake has to do with over the counter glasses. So that you can purchase in your pharmacies and so on. And these are mass-produced, I tell my patients. So there's no absolute surety that these are made up to optical standards, and there may be errors in them. And because you don't know, you put it on and you force your eyes to look through these errors to be able to see. Some persons wear them throughout the day, so for driving, for walking around, and that's not what they're designed for. It's really just magnifiers in a frame to help you to see for your near tasks.
Okay.
So purchasing, I know with the economy these days, it may be the more cost-effective way. So if it is that reading glasses are all you need, come into your optometrist and discuss with us, and let us help you find a good pair.
Okay.
Right?
Good. So those take care of the mistakes. Now let's deal with the myths now.
The myths, yeah. I just have a few myths.
Okay.
Great. So the first one is about the sun. Is the sun good for us? And the answer is yes, if it includes moderation. So coupled with the climate and the environment that we live in, which is very highly polluted, and the fact that we're on computers and devices all the time, and we can have dry eyes. So dry eyes, and then the intensity of the sun that we have there, you can have the occurrences of two things in particular, pterygia and pinguiculars. And the pterygia is a nasal fleshy growth that grows in the nasal conjunctiva, and the pinguiculars are yellow bumps that can grow either nasally or temporally.
Okay.
Both affect tear flow. They both can cause irritants to stick on them, can get the eyes very itchy, red, and inflamed. And they are reasons you would want to visit us if you do have them. The pterygia is that can grow, even to grow over the center part of the eyes, and that can obscure your vision. So when we check and we measure it and so on, and we say, okay, this is ready to be excised, we would refer you accordingly. However, to help if you do have those things, or to help reduce the chances of getting that, we usually recommend that you get a pair of polarized sunglasses.
Right.
And these are the superior choice for sun protection. The entire thing is made of optical quality, and what it does, it's chemically treated to help reduce the amount of sunlight coming into the eye.
Right.
And it significantly reduces glare as well. So when you put it on, your vision is much cooler, and definitely your eyes feel much better under them. They're a bit more expensive, but as I said, they are the superior choice.
Right.
The ones that you get in the pharmacies or off the streets, these are just tinted, and your pupils will dilate under these tints. So these tints are not chemically treated in any particular way to help with UV. Some are 100% UV blocking, and those would be good.
Those would be good, okay.
But again, I said superior would be your polarized sunglasses.
Okay.
And these sunglasses are also mass-produced, and they're not really good quality things.
Right.
And because I said before as well that your eyes are so important, they deserve the best products of whatever you're using.
Wow. Wow.
So that
takes care of the myths.
the myths.
All right.
Yes.
And to recap, because you said we can look into your eyes, or you can look into our eyes and see whether there is some disease that might be developing.
Right.
It sort of fits into the text I read earlier. The eye is the light of the body, so that you can look at the eye and see what's going on with the body. Speaking of which, Abigail, how soon should we begin looking at the eyes? Or not we, how soon should you guys be looking at eyes that I have to do exams?
Well, we would say as young as possible, usually for getting glasses or checking, we would start from preschool age.
Right.
So like between 3 and 5.
Right.
However, if you see any problems before that age, be sure to go in and get your child's eyes checked out.
Wow.
Yes.
And according to Sherry, this is every 2 years.
Yes,
Once
at
you start
least.
every 2 years, even if there's no itching, there's no problem, you just go into the optometrist
Yes.
and have your eyes checked out.
Yeah. So I usually tell my patients, getting your eyes examined every 2 years. It's not just perhaps to change your glasses. It's also to ascertain the health of your eyes. What is your ocular health status? So it's very important to know as you are aging as well.
Right.
Are there any changes? And it's always best to pick up changes in its earliest stage.
Right.
Yes.
So every 2 years is what we recommend.
And one thing in particular that we worry about is glaucoma.
Oh,
Yes.
wow.
So glaucoma is a group of eye diseases that can affect the optic nerve. It damages the optic nerve.
Is it age-related, glaucoma?
It is mostly age-related. A number of other factors can cause it as well.
Right.
So if you have it in your family, it could be hereditary. If you were born with it as well.
Okay.
And if you're of the African heritage, you have a greater risk of developing glaucoma.
Do you know of any known cause of glaucoma?
A few things. One, when the fluid in your eyes, when it's not draining as it should,
okay.
that causes an increase in the pressures in your eyes.
Okay, okay.
So with glaucoma, we look for 3 things. We look for increased pressures in your eyes. We look to see if the optic nerve is looking like it's being damaged.
Right.
And the third one we do is a visual field test,
Right.
where we put you on a machine and it checks your peripheral vision as well as your central vision.
Can it be cured?
Unfortunately not. There are things to treat it or manage it, but glaucoma cannot be cured.
Okay, okay.
Yes.
And what about cataract? Because I've heard a lot of folk who have cataract and they have to get some surgery done.
Oh, yes.
Cataract is curable.
Yes, it
Okay.
is. Well, it's not really a disease, it's more of a condition.
It's a condition. Okay.
Yes, so cataracts is a clouding of the normal lens
Right.
of your eyes.
Okay.
And this is mostly age-related as well. You can also be born with cataracts.
Or you could be born with it.
Or you can develop a traumatic cataract.
Okay.
So if you were in an accident or something hits you in your eye, you could develop a cataract as well.
Okay.
Yes. But the age-related one, in particular, they would do surgeries. So they would put you to lie down and they would remove the hazy lens.
Right.
And they'll put in an artificial lens and you'd be able to see well or even better than you used to before. Yes.
I hope you are looking at JC 24/7 with your eyes wide open. We are talking about the eyes that have it and what it does and what benefits you can have by having healthy eyes. Please stay tuned. If you can't hear us, please look for us after the break.
Did you know? The human eye is rated as the second most complex organ after the brain. First of all, more than 1 million nerve fibers connect each eye to the brain. 80% of our memory is determined by what we see, while our fingerprint has 40 unique characteristics. The iris of the eye has over 250. No wonder retina scans are used for security purposes. Right behind the pupil of the eye is the lens, which focuses on objects you look at. Take a look at various distances around you, and you would see that your lens instantly changes focus without you even being aware of it, much faster than the lens of a camera, which takes a few seconds to focus between one distance and the next. If the human eye were a camera, it would have had a resolution of 576 megapixels. Surgeons have not found a way to transplant the human eye simply because they would have had to interfere with too many nerve fibers to complete the transaction. Amazing, isn't it? Jesus says, taken from Matthew chapter 6, verse 22, the eye is the lamp of the body. If your eyes are healthy, your whole body would be full of light. We therefore ought to be very careful what we allow our lens to focus on, for images are being stored in the memory card of our mind, and what we focus on can affect who we ultimately become. Because as you know, the eyes have it.
The eyes have it. We are talking to two qualified optometrists in the person of Abigail Cezair and Sheressa Gangadeen. Let's go to Sheressa this time. The whole question of diabetes. How does diabetes affect the eyes?
Okay, so according to the World Health Organization's definition for diabetes, it is diabetes is a chronic metabolic disease that is characterized by elevated blood sugar levels. And over time, this can lead to serious damage in the heart, in the blood vessels, in the kidney, in the nerves, and even in the eyes.
Okay.
So diabetes can affect the eyes in 4 ways. You can have diabetic retinopathy, which is where the blood vessels at the back of the eyes can leak fluid, and this will distort your vision. There are very subtle signs that your optometrist can pick up if there are any impending bleeding about to occur. So that's why, again, if you're diabetic, we usually advise that you see us yearly for a dilated fundus exam.
Okay.
And what we do for a dilated fundus exam is we put some drops into the eyes, it dilates the pupil, and we're able to have a much bigger, larger view at the back of the eye and able to see the blood vessels and everything much better. Apart from diabetic retinopathy, we have diabetic macular edema, which is swelling of the macula. And the macula is that part of the retina that is responsible for clarity of your central vision. And you use your central vision to recognizing faces or for reading and so on. Apart from that, you can cataract. You're 2 to 5 times more likely to develop a cataract and even develop it at a younger age when you have diabetes, as well as glaucoma. Your risk of developing glaucoma doubles if you have diabetes. So I usually tell my patients that it's not a death sentence, you know. You can overcome it. Sorry, you can overcome it. So usually I tell them, of course, you need to keep your appointments, go to your doctors when you are discarded to do so. And you need to take your medications. Now, some of these medications have side effects. They can interfere with your body in different ways, so they may not always agree with you.
Yeah.
Instead of just stopping it on your own, you need to speak with your physician and let them know that this is not agreeing with you, and they can help you to, they can give you something else that can work. Apart from that, you need to be physically active. That helps a lot. I mean, just on the across the board, whether you're diabetic or not, as well as maintaining healthy diet. So you would want to stay away from your refined, white, and processed foods, and you'd want to include more organic and whole foods.
Okay, speaking of foods, let's indulge you a little bit, because when I was younger, they told me that eating carrots is good for your eyes. How true is that? And other such foods, I suppose.
Yeah, that's very good, because what we look for in your diet that would contribute towards healthy eyes and the development and possible delaying of diseases.
Okay.
There are some foods that have carotenoids in them, so like your broccoli and your spinach, your dark green leafy vegetables, they have something called lutein and zeaxanthin, and those are very important towards delaying macular degeneration. They have those vitamins help with the macular function. As I said before, the macula has an immense function.
Right.
Apart from that, the carrots and the red fruits or vegetables, they have something called astaxanthins, which again is to promote healthy environment of the eyes and help reduce the occurrence of even cataracts and, well, mainly macular degeneration.
Is there a specific way in preparing them?
Well, for vegetables, you would always want to have them slightly cooked at least, and then, well, you can have your fruits raw as well.
Okay. Abigail, this is a question I have been dying to ask to both of you. Has to do with computer, watching of the computer. Because there are people who are asking, what effect does watching the computer for sustained periods have upon your eyes? I particularly feel that it may have damaged my eye after a period of time. What sayest the optometrist?
The name for it is computer vision syndrome. It's also known as digital eye strain.
Oh, there is a condition.
Yes.
Okay.
And you develop this from using devices for long periods of time. So like using your computer, using your cell phones, yes, and looking at television as well.
Right.
So many things can happen. So, for example, you could have blurred vision, you could get eye strain, you could get headaches, you could get neck and shoulder pain, as well as dry eyes.
Right.
Yes, from such a condition. And one of the things to look out for, one of the main things, is blue light. So blue light it could be good and bad. So the sunlight is the main source of blue light. And you can have man-made blue light as well. So any fluorescent lamps or LED lights that come from your phone or from computers or your tablets, that has blue light as well. Blue light is good in terms of it improves your mood and your alertness as well as your memory function. And it helps with your circadian rhythm.
Excuse me.
Yes, so this is your wake-sleep cycle.
All right.
Yes, so the sunlight, for example, when the sun is up, it tells you, okay, you ought to be awake and doing things. And when there is no sun, your body, it gets tired and, you go to sleep. So persons who work on shift, for example, they may have trouble sleeping at night. And they may have tiredness during the day because of the circadian rhythm.
Okay.
Yes. So back to blue light.
Okay.
The bad in blue light is that it can damage your eyes. There aren't many studies just yet because we've only had smartphones and these things for about 20 years. So they're still doing studies. But UV light, for example, it could be blocked by the cornea and the lens of your eyes. But blue light, it isn't blocked by the eye, sorry. It goes all the way to the back of the eyes and can damage the light-sensitive cells at the back of the eye. So one of the things that we tell people to do is to probably reduce the amount of time that you spend on a computer
Okay.
or on your tablets or
Right.
phones. You know, young
Right.
people, they're always on their phones
Tell me
all
about
hours.
it. Young people alone?
Oh,
All right, there you go.
yes.
No comments.
And the blue light, it could affect your circadian rhythm. So it will fool the body into thinking, okay, at night, it will
Right.
fool the body into thinking, okay, I ought to be awake right now.
Oh, okay,
Yes.
okay.
Another, sorry?
Go ahead.
Oh, yes. Another thing we tell people is they could probably get computer glasses
Right.
with an anti-reflective
Oh,
coating
there is
on
such
it.
thing as a computer glasses.
Yes,
Okay.
and it blocks out the blue light.
Okay.
Also, some smartphones and tablets, it comes with a blue light filter.
Right.
I saw it on my phone as well, so you
Right.
could just click on it and you have the option to filter out the blue light.
Okay.
And the good news for persons who wear glasses with transitions, or what we call photochromatic lenses,
Right.
those lenses actually filter UV light and blue light.
Very good.
So if you have those glasses already, you don't have to get a new pair
Very well.
of
Put them on
computer
and watch the
glasses.
computer.
Yes.
All right. Sherry, let's come to you because I know of some treatment or some procedure we can use to help us, the 20-20-20. Would you explain a little bit about that, please?
Right, so the 20-20-20 rule is where you take a break every 20 minutes to look at something 20 feet away for at least 20 seconds. And in so doing, you relax the muscles of the eyes. When you're on your computer, that short distance, the muscles are a bit constricted or constrained. And so when you look far away, they're relaxed. So taking a break is necessary to relax the eyes so that it will reduce your chances of getting computer vision syndrome
Wow.
symptoms or
Right.
reduce your risk of digital eye strain.
Okay, so it's 20-20-20. Every 20 minutes, you look away for 20 minutes.
20 seconds.
20
20
seconds.
seconds,
There
yes.
you go.
At
Something.
least 20 seconds.
Right, at least. So it could be 20 minutes too. That wasn't so wrong.
Okay.
And at a distance of 20
Feet.
feet. That's
Which is just anywhere in the distance, really.
very good, very good. We have to begin to wind up. And I'm sure as you study the eyes, because, you know, we opened the program with a text. And Jesus is the creator. He is the one that said these words. The eye is the light of the body. What lessons have you learned about the eye that reminds you of your creator?
Yeah.
Sheressa.
Okay. Well, this is a very simple thing about the eyes or
Right.
tears. And
Tears.
yes,
Okay.
tears. Very simple. But I've chosen to speak about it because even though it's simple, the physiology of it is just so complex.
Right.
So we have 3 different types of tears. We have basal tears, which are constantly being produced, and these are to protect the eyes and keep the eyes moist.
Right.
We have the reflex tears. These are what are produced in a mass amount. Let's say, for example, when you're cutting an onion,
Oh, okay.
right? And the synpropantheol S oxide gas of the onion.
I wouldn't ask you to repeat that. Right.
What happens that irritates the eyes and causes the eyes to become
Right. Okay.
to discharge,
Right.
for the tears to discharge. And so it does so, and that tear flow is composed of antibodies so that to prevent any sort of microorganisms from getting into the eye. So
Wow.
that's your reflex tears.
Wow.
Right, and then we have the emotional tears, and these are well, usually you would experience these tears if you're happy or sad, and these are composed, they have a higher level of stress hormones and encephalin, which is an endorphin, which is to increase the happiness of your mood.
Wow.
And when you cry, this particular type of tears, it reduces the heart rate and helps calm you down. It's
Okay.
also to elicit social empathy.
Okay.
So we have 3 different types of tears.
Oh, excuse me.
And to know that God designed us in such a complex way, but still, when we cry, different things happen. We're not really thinking about it.
Right.
For example, let's say you're not thinking, okay, did I produce enough reflex tears? Do I have enough there? Is it,
Right, I
it's
hear
an
you. Okay.
autonomous thing.
Right.
So to know that God thought about all these things, even
tell
something
you.
as simple as our tears, depending
Oh.
on what activity we're doing or what environment we're in, they're so designed to help us in that situation.
It's amazing. We have 3 gentlemen in the studio here, one of which you are looking at. And we men think that it is wrong to cry because it's a sign of weakness and we don't want to be weak. What advice would you give to men who don't like to cry?
Crying is not a sign of weakness. It's just a natural thing. It's natural physiology, how we're made. And as I said before, the tears have, in each type, they have a specific role, a specific
Right.
function.
Right.
So not crying, which means they're not functioning in the way that you were designed to.
Right.
So there is no weakness in crying. It's a part of life.
In fact, you could deprive yourself if you don't cry.
Yeah.
Wow. Wow. I want to thank you guys for taking the time to be with us. We certainly couldn't deal with every condition of the eye, but I think we were able to stimulate the audience enough so that you know that God made the eyes. He made the eyes. He said the eyes are the light of the body. And he himself said where there is no vision, the people perish. So some people have eyes, but they don't use it to see what God wants them to see. So gentlemen, as you have heard Sheressa said, it's all right to cry. You're not a weak man. In fact, you are a strong man when you are able to confront your own weakness. And for the rest of you, please use your eyes. If you can't see, please, you can look onto Jesus. He will remain the author and the finisher of your faith. You know why? Because the eyes have it. See you next time on JC 24/7.
Thank you for viewing JC 24/7. Be sure to subscribe to our YouTube channel and remember to inspire your living as you prepare for heaven. You can get it all on JC 24/7.